I am here with Dr. Katie Eagle. She's actually our pediatrician at New Kingdom Wellness, and she is a doctor of nursing practice. And so we're going to talk a little bit about, I feel like maybe a hot button. I feel like a question maybe that comes up often using antibiotics for ear infections and some of that kind of stuff. But also, Katie started her own business recently, so I want to talk to her about that and see how she's helping people there. So, hi.
Hi, thanks for having me.
Yeah, for sure.
So ear infections, I think the tricky thing about ear infections is they can be kind of subjective. The American Academy of Pediatrics has kind of changed their protocol too on diagnosing and treatment of ear infections just to create more stewardship of the use of antibiotics. And so some people are more mindful about that protocol that's been implemented. So um, some people treat ear infections with antibiotics right away with a child, and some people follow the protocol of waiting 48 hours, making sure the child, seeing if the child is febrile and develops a fever, etc., before starting antibiotics. Because there are other ways to support a child that's developed either inner ear fluid or inner ear fluid that has um, gotten infected. So other supports are, mechanical, if your child has enlarged lymph nodes, making sure that there's some lymphatic drainage and movement of the lymph nodes. Some people will use nourishing herbs like echinacea helps to drain lymph nodes. Propolis, or some people say propolis, garlic, which can be pretty spicy for kids, but of course that has nourishment for the lymph nodes and inflammation, right? Because we need to treat the lymph nodes and the inflammation, and then of course support the immune system, which all three of those things would do. Some people use chiropractic to help, or craniosacral to help with that movement of the fluid out of the ears. So there's lots of options. People do like the rice sock, different essential oils. Um, some people just are able to treat it with, some ibuprofen for a day until the body takes over too. So there's lots of tools for different childhood ailments. And that's a great example because, some people have different comfort levels, and some people don't always respond to the antibiotics right away too, which doesn't necessarily mean it's an issue with the antibiotics or the child, but just that, they're requiring some other support too with their body.
Mhm. Well, and I wanted to say too that so my husband's a physician assistant, and so he's on the holistic side of he's on board with me because I tend to see things a lot more holistically and want to treat things holistically. And so we knew when we had kids, we would likely disagree on when we are going to use Western medicine.
Yeah.
And so we when we found you as a pediatrician, we had seen a few others first. We agreed that okay, whatever Katie Eagle says goes. If she says okay, I think it's time to use some antibiotics, okay, because Dax has been on antibiotics once now for an ear infection. But so you're saying that you the standard now or the new guidelines are waiting at least once we see an ear infection or notice symptoms, waiting for 48 hours before prescribing antibiotics.
Right. Yeah, and that's like typically between a 6 month old to I believe it's 12 years of age is that's what the protocol is designed for. 6 month less than 6 months would be different. But yeah, if the child, unless the child is like nonverbal or is unable to communicate pain or if there's something else, but typically the protocol is to wait, and then providers can send antibiotics for parents that want to do a wait and see approach. um, and then of course it's like, what else is going on with the child? Is this the second antibiotic in the last 30 days? And kind of like the sequelae of, what's been going on with their ears too.
Sure. Well, because then too, I assume in that 48 hours is then the good time to use some of the the immune support you're talking about, chiropractic care, those sorts of things.
Right. Yeah. Yeah,
Okay.
exactly. Yeah, because so many ear infections are viral, like the etiology is not always necessarily bacterial. And so if it's viral, your immune system should, be able to fight that and handle it. And certainly your body could handle, bacterial too, but that time kind of helps to tease out that support and etiology too.
Yeah. Well, I think that we talked about this once when I was in terms of like taking even if you do end up on antibiotics, like taking some of those other supportive things like echinacea and garlic and things like that while
Yeah.
you're on the antibiotics is going to help it work better anyway.
Right. Right. Yeah. Because then you're boosting your immune system. Yeah. You're helping nourish your lymph nodes and helping to drain fluid and inflammation. And then even tagging on like a probiotic in between antibiotic dosing, right, to help support gut flora during the antibiotic course.
Sure.
Yeah.
Um, is there like when you're talking about garlic, I mean we talk about like the garlic Malayan drops here,
Right.
but like are we talking oral? Is there certain brands that you like to use?
Yeah. So if you look at some of the herbal preparations, a lot of them do have oral garlic infused into the tinctures.
Sure.
So it just has to be mixed for a child to be, accepting of that.
Sure, right. And I think Wish Garden Herbs is like what we've used before, and that like that's a brand that you like using.
Yeah. Yeah.
Yeah. Sure. Okay, great. Those are good info for people if they're wondering what to do with the antibiotics. I mean, when Dax took it, I was having a panic attack at home nearly. Like, oh my God, it's just gonna mess up everything. It's terrible. But like it turns out okay, and they're resilient and they're fine, and we can support them afterwards. And
Right.
he was no
Right.
monster away. He was fine.
And that's like such an appropriate use of antibiotics, right? Like that's antibiotic stewardship is trying the things, seeing what works, giving them, that's what it's there for,
Right,
blessing them, moving on, supporting as terrain after.
right.
It's kind of like your intention around it and everything.
Yeah, exactly. Okay, so now you're still at New Kingdom 1 day a week, is that right?
Yep. Yep.
Ish. And now you're doing your business called Waning Moon Wellness, correct?
Yeah.
Okay, tell me more about that. Tell me what you do. Tell me how you help people. Tell me how people would know that they want to seek help from you.
Yeah. So Waning Moon is in Linden Hills in Minneapolis, and it is you know, a more of a root cause approach where we work with what's the imbalance in your body and what does your body want to support it. So a lot of times, people are using educated guesses to help determine what supports the body needs. But through this approach, if you're used to like applied kinesiology or muscle testing, it would look similar. But this is called autonomic response testing, which is actually where I'm looking at the light emissions coming off your body and then testing that against those muscle spindles that people often are used to, like with arm testing.
Mhm.
So you can actually check the coherence of light coming off tissues and organs, and then compare that with, what does your body actually, what's like the priority of your body, what's out of balance, what supports do you need? So some people come in who, like for example, are getting amalgam mercury fillings removed and they want to do a heavy metal mercury detox. Well, there's so many elimination pathways. You have to make sure that your lymph nodes are being supported and nourished, your kidneys, your bowels, right? Like you just don't want to go into a heavy metal cleanse and then reaccumulate the toxins.
Mhm.
Like that's one example. But a lot of people, honestly, it doesn't always matter what like the diagnosis is, because typically when you just ask your body, like, okay, what nourishment do you need? What is out of balance? Whether that is like a tissue organ, a nutritional need. Once you support the body actually just takes over and corrects itself.
Mhm.
So some people come in for, you know, testing for, let's say they're pregnant and they want to know where their nutritional levels are at, or like postpartum moms that aren't quite feeling like themselves. They can get nutritional assessments through Waning Moon, and then have their body prioritize, okay, what nutrition does it want, what foods does it want, and then get like a pretty customized plan. I treat or support a lot of lactating moms too, and then their babies to see, a lot of moms want to know about like what foods to cut, or where it's just can be such an overwhelming process with the lactating mom because you've got you and your baby to consider. So it's nice to be able to test mom and baby together and look at, okay, what is the nutrition, but what's the emotional status of mom and baby? What sort of emotional support do they need? And then I'm able to create like custom flower blends for the dyad. So like the application of ART is pretty widespread. Um, And it's fun because it's just exactly what you need at that moment. And that's that. So fun.
Yeah. So those are some of the things that you're like seeing often, or at least that you like seeing right now.
Yeah, and it's like, kids come in with, maybe like attention and focus. And it's the same thing. It's like, okay, let's nourish the liver. Let's
Hmm.
nourish the brain. Let's see if elimination pathways are open and happy, and just re-nourish. I use some supplements, but mostly it's herbs, superfoods. I do some emotional support too, because some people just have stagnation because of stored emotions. Like a big example of that is like scars or tattoos or surgical wounds, like they can almost be like antennas for different emotions. And so, that's a whole nother component of it too, that sometimes, well, often gets missed. It's just the energetics and emotions of our body.
Yeah. Love that. Cool. Well, where do we find you? Maybe Instagram, website.
Yeah, so waningmoonwellness.org is my website. And then Instagram is Dr. Period Katie Eagle.
Awesome. Well, thank you for your time today.
Yeah, thanks for having me. I
No
appreciate it.
problem.